Greetings and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and also Chief Medical Officer of Good Samaritan Physician Network. Joining me, Adam Thacker, who is our Chief Operating Officer and Pharmacist at Good Samaritan Hospital here. We'll be giving you an update this week on COVID, as we usually do, but we're going to lead off this week with men's health issues, and that's because we are in Men's Health Month and, in fact, Men's Health Week. And so something that sometimes gets glazed over, we sort of joke in primary care that we see men for their adolescent last sports physical at age 18, and then we don't see them again until their first heart attack at age 55. And so what we're really going to be talking about is trying to avoid that gap in care and talking a little bit more about wellness and appropriate screenings and vaccinations, and talking a little bit about what offerings we have here locally as far as the hospital and our community is concerned to help keep men plugged in to that service and not fall off the map for that 30-year period of time.
Yeah, and as you talk about, men, as we know, are less compliant with preventative care. Many times we're waiting until we have an injury or feel bad, and then we're checking out Google Doctor, and then it gets bad enough that we go to an urgent care emergency department and haven't really established with a physician. So most of what we're talking about with men's health is preventative care and staying on top of routine health maintenance, which kind of starts with having a physician, a primary care physician that you have that relationship with, that is trained and skilled in knowing these are the screenings that are age appropriate, whether that be lab tests such as what we do at our Men's Health Tune-Up with lipids, prostate. It could be as simple as blood pressure cuff and measuring for hypertension to see if there's treatment needed for that. And all of these, when we talk about screenings, it's about early identification, working with family physicians such as yourself to identify if there are health needs, and also stay on top of getting that information back to say there aren't, and you get that clean bill of health and can continue about your activities and not make lifestyle changes or diet changes that really need to be made. And so when you have that relationship with physician, it's about identifying those. It could be an annual wellness visit, which could be a physical. So both that physical examination, but also asking about wellness. And it's not just physical. We talk about mental health, and certainly with COVID, we talked about mental health many, many times, and the strain that the pandemic put on individuals from not being able to work or being isolated. And so we've seen that suicide rates and mental health rates have went up pretty dramatically, and the rate in men is higher than in women already, and that's only been a gap that has spread even further. So the behavioral health element is just as important as the physical element.
Yeah, absolutely. And as Adam is saying, one of the important things that we do once we have that relationship with patients is tailor that wellness and health care to the individual based on their age, based on their family history, based on their risk factors, and then that changes over time. What a lot of people don't realize is we just don't shoot for the same thing on everybody based on age as far as blood pressure and labs and cancer screening and so forth. Because when we look at the younger population, that 18 to 25-year-old range, the greatest risks for them are actually drugs, alcohol, motor vehicle accidents, suicide. And so we want to look at those things and screen patients for that within that age range, along with all the usual health care that we perform, which is making sure that they've had their labs done, that they have had any appropriate screenings, vaccinations, all those types of things. Because if we can prevent those things ahead of time, as Adam is saying, that's really what our goal in medicine should be. While we focus on treating diseases a lot of times, really the best case scenario is catching high blood pressure early when we're screening for that, catching depression with screening, catching people who are at diabetic risk, helping people to quit smoking by counseling them on that, looking at high-risk behaviors, alcohol abuse, drug abuse, vaping in our younger population. All of these things are part of what we consider to be wellness, and looking at that and screening for that ahead of time. And there's lots of things that get offered within our community and other communities that are offerings through hospitals and screening labs and things like that that are outreach to help people get plugged into the system, not just to get labs done or not just to have cancer screening done, but also to get plugged in with a primary care system.
Right. And the largest event of the year for Good Samaritan is our Men's Health Tune-Up. And that is coming up in November. It's November 8th. We'll have morning and afternoon sessions. There have been some changes to the Men's Health Tune-Up, COVID related, but they worked out really well to where post-COVID, as we're moving in that direction, will change a little bit. We used to have, it was pretty much a show up, free for all, and get in line, and we would draw blood pressure test, have different stations where you could get your O2 sat, your pulse oximetry done, grip strength test, those types of things. That's all still going to happen. So the same tests that will be performed and everything, but now it will be through, you can schedule online or contact our marketing department to get that set up. And there will be morning sessions 7 a.m. to 10 a.m. and then evening sessions 4 p.m. to 6 p.m. to try to tailor to availability of our community. And as you mentioned, that's a great place to get kind of that baseline, whether it be lab test or other results to say, do I have something going on that now I need to talk to my physician about? And if you don't have a physician, we can also help with our Find a Provider online. We'll have resources at the Men's Tune-Up to say, following your results, this is what you should do with those. Or you get that clean bill of health. We would still say, get established with a provider, but you get those results back that tell you, okay, this is what I've got going on and where adjustments need to be made if they do need to be made.
Yeah, and the timing of that Men's Health Tune-Up is somewhat strategic also. We try to get people out of some of the busiest times of the year. It's late in the fall, early in the winter, so people are coming in out of the fields. Farming's kind of slowing down. It's before the holidays, and so it's strategically placed so it's more convenient for men to get involved in that. And also the time spread is such that there's a big window of opportunity to get in and be seen also. And during that event, it's a broad spectrum of offerings, everything from laboratory tests, as Adam talked about. We like people to get screened for diabetes. We want them to get screened for chronic kidney disease. We want them to get screened for high blood pressure, lipid disorders, and then any other risk factors, because many of those things we just listed off are asymptomatic. People walk around with high blood pressure all the time. We have patients routinely that come into our office having no symptoms whatsoever with blood pressure that's 200 over 110. They feel perfectly fine. And so screening for blood pressure is recommended at an early age. We actually start doing that in kids and adolescents. And we start talking a little bit about routinely following up on that. And then as you get a little bit older into your late adolescent period, early and late 20s, we talk about cholesterol screening, diabetes screening, obesity screening, and then a bit of that high-risk behavior in terms of smoking, drugs, alcohol, self-destructive type behaviors, and so forth. And then we like to look at updating things in terms of cancer screening as we get a little bit older. So the cancer screening guidelines for us guys have changed a bit over the years. We have talked a bit previously about prostate cancer screening specifically and colon cancer screening, and those recommendations have fluctuated back and forth several times over the past 20 years. Currently, colon cancer screening is recommended for normal risk individuals starting at age 45, used to be 50. And prostate cancer screening is started generally at age 50, depending upon what race is. Sometimes that started earlier in the black population at age 45. But we also want to establish that relationship with patients because we want to look at what your family history is. Because if you have a family history of a primary relative who has had colon cancer, let's say in their 40s, we actually want to back the clock up and start on you about 10 years earlier. And so that offering where we talk to people at the Men's Health Tune-Up is to talk about colon cancer screening and prostate cancer screening and the lab and procedural tests that are offered for that.
And I think for anyone watching this or looking at how do I manage all of that, I have my job, my personal, I'm trying to manage all these things in my life. How do I manage when to get screening and know all of this? Well, that relationship with the physician, nurse practitioner that is trained in looking at those things, having that annual visits or checkup, our electronic medical record also helps to guide that because you're going to get a summary of these are the screenings that are age appropriate and you're eligible for. And we look at things that in our world we call gaps in care, meaning that if you see me as a patient, as you see me there, it will pop up and say, 40-year-old white male, these are all of the screenings that need to be done. And you go through and check the box, have they happened or not? And that creates where they haven't, that gap, that then you can have the conversation with and say, these are the things that we need to do, because otherwise they're going to be missed.
Yep.
You know, if we just kind of put it out there and say, hey, at 45, you need to get your colonoscopy. Well, it's not a fun event that I just am looking forward to. So I'm going to wait until 45 when I have my appointment with you, that you say, okay, we're at that age now, you got to do it.
Yep.
And so that's how we help to partner in the care and stay on top of that. And for the men's tune-up plug, just for the competitive men out there, we had our women's tune-up just a couple of weeks ago, and I think we were just shy of 300 women that came through. So we have to have at least 301 men come through. I'd be thrilled with 600. We'll try to double that number. So get your appointment early, get set up, come through, and then the other element of the medical care that I get from patients from time to time is, I feel healthy. Why would I go pay a doctor to tell me I'm healthy? Well, most insurance plans, almost all, I believe, cover that one-time annual visit at 100%.
Yep.
So that's a big value as well. There's not a big out-of-pocket to stay on top of your health. But then when you talk about that heart attack, how many times do we hear, I felt healthy, but they're sitting in a hospital bed talking to you about the heart attack they just had? That is going to incur a cost, and a cost not just to a health system, but a cost to the individual, whereas that's potentially preventable by keeping up with routine maintenance.
Yeah, and more insurance companies are getting more proactive at that. We as an organization, Good Samaritan Physician Network and hospital, we reach out to our patients that are established to say, hey, it's been a while since you've been in for a normal visit. It's been a while since you've had labs done. It's been a while since you've had vaccines addressed. We'd like you to come in and get reestablished. But insurance companies are doing the same thing now, and they are sending letters out to patients saying, hey, you haven't been seen in 3 years. You are overdue for this vaccine. You're overdue for that laboratory test. And so they're encouraging and pushing patients to come in and get those things done as well. And just like Adam said, most of the time, screening services as far as yearly wellness exams are at no deductible, no cost. It's free of charge because your insurance companies want you to be healthy. You will cost them less money if you are healthy. And so whether that is a good or a bad incentive, it's important to realize that that's something that they want you to do and that we believe strongly in. And sometimes it's something as simple as vaccines. Part of the gaps in care and things that we get reminders on our phones for and through our healthcare system is to get updated on vaccines. One of the first ones is we all get due for tetanus, and about the only time us guys come in to get tetanus is when we drive a nail into our hand or step on a piece of broken glass or something of that sort. And as a result, then we come back in to see the doctor, we get our lacerations sewn up, and get your tetanus booster. Well, really, you should be getting those tetanus, diphtheria, and pertussis boosters every 10 years. When we turn 50, we recommend men getting in and getting shingles vaccine performed as well. We talk a little bit about pneumonia vaccine for people who are at higher risk. So you may be asthmatic, you may be needing pneumonia vaccines on a routine basis as well. And then, of course, flu vaccine is something that's recommended for everybody now on a yearly basis. One of the more pertinent things over the course of the past year, of course, has been the discussion of COVID vaccine and where it's been available, and there has been some evolution of that over the course of the past few months. So would you kind of tell everybody sort of where that's been and where it's transitioned to now?
Sure. Yeah. So we go back, starting 2021, mass vaccination was the big focus. Good Samaritan providing vaccine. Knox County Health Department about a month later stood up providing vaccine. Our local retail pharmacies, Walgreens, Walmart, CVS, then joined the party in being able to provide vaccine as more vaccine became available. Fast forward to May. At the end of May, Good Samaritan closed the mass vaccination clinic because we had really worked through that age eligibility to where it was open eligibility from age 12 on. And now Knox County Health Department is still providing vaccine at the health department site. And talking to Dr. Stewart, they're still seeing individuals come through every week for first vaccination, so that's good. Knox County is just shy of 44% fully vaccinated, meaning that if it was the Johnson & Johnson vaccine, they've had their one shot. If it was Moderna or Pfizer, they have completed both shots, and it's 2 weeks post-shot to be considered fully vaccinated. We know there's a group of individuals that are within that. I've had my first shot, haven't had my second shot, so there's still some of that hanging out there. But that vaccine rate really climbing to 44%. And what's probably most important with that is the older population, 60 plus. We've seen that uptake be more in the 70+% across the board, which has driven infection rates down. And so good news today is we have 0 active cases in Knox County. Our positivity rate is 1.3%, and really seeing a very low transmission across the community. But there's always a little bit of air of caution to be said that, we still have areas that are masking appropriately, still have individuals that have held off on being vaccinated. And so we've got to be careful, because even today we have patients that still end up in the hospital for COVID that are struggling from a health standpoint. Not seeing the severity of illness that we did many months ago, but we still do see that. It's important that while things look really, really good in our community, that we're still mindful of what got us there, which is increasing vaccination rates, attention to hygiene and our hand hygiene, washing our hands, and wearing our mask where appropriate in close contact.
And it's important to realize how effective those measures were. I hear people all the time talk about how frustrating it is that we continue to mask. Certainly in all of our healthcare facilities, we are masking now, and we will continue to mask. But things have opened up tremendously, and what we have seen, interestingly enough, is an increased rise in viral upper respiratory infections. So I don't know if you or any of your family members, but certainly some of mine, have experienced the summer cold over the course of the past few weeks. Thankfully, it's nothing severe, but lots of patients have been coming in with those types of symptoms, and it's because, as we have relaxed those measures, more of the normal viral illnesses that we see throughout the year are coming back to life. So the measures work. The vaccine has worked very well. The masking has worked very well. And as you were discussing, there's still going to be instances where people need to continue to mask. Certainly in facilities that are requesting that you continue that, please be mindful and respectful of those places. Sometimes the reason they're having you mask is because of the safety of their employees. For us, obviously, it is for our patients and also for our employees as well, and for all the people who visit our hospital. It's important to be respectful of that, despite the fact that the mask mandate has been pulled back. It's important to realize that each individual business and facility is going to have their policies on that. And that's something that we will continue to revisit as we move forward, and our schools will look at as we're talking about moving into the end of the summer and the beginning of the school season.
Right. When we look at it from a pure state mandate, even though the masking mandate was pulled back in May, there were still elements of that were not, which healthcare and schools were not. Mask mandates still in effect. Now, schools, that mask mandate expires at the end of this month on June 30th, and then going forward, that is left to the decision of local school boards to make a decision. I'm sure that there will be school leaders, community or health board leaders, Dr. Stewart in particular, and talking about what that approach needs to be and make some decisions in moving forward. From a healthcare facility standpoint, Good Samaritan, nursing home facilities in our community, masking is mandatory, and this is regardless of vaccination. Masking is mandatory in our healthcare facilities, and you'll see signage if you come to Good Samaritan that will show that, regardless of if this is an outpatient area, inpatient area. If you're a visitor, if you walk in the doors, a mask is expected to be worn. And that right now is a state mandate. Still discussion amongst the Indiana Hospital Association as to, and giving input as to how that goes forward. But I get the question all the time, when's that going to end? And my response now and until at some point in the future is it's indefinite, because that is what we've been told, is plan for this indefinitely, and there's an element of it that may last a very long time, because we know it does work, and ultimately in a healthcare facility, the safety of our patients and the safety of our employees is paramount.
Yep. And so one question I get asked frequently is, well, why should I get a vaccine now? So, I mean, if we talk about compelling reasons to get vaccinated, if you are 80, if you are 40, if you are 15 years old, there are differing reasons to do that. Certainly one of the ones I get most commonly now is a lot of our older population has been vaccinated. The population that has chosen to get vaccinated, that's in the 30s, 40s, 50s, they've gotten their vaccine. And now that younger population, well, why should they get vaccinated? And probably the most compelling reason is simply to reduce the likelihood of illness as we reenter schools, to avoid the potential problems and complications associated with quarantine if you are exposed, to stay in sports. All of these vaccines have been proven to be very safe overall. The ones that are being used in the pediatric population have proven to be very safe also. And so I have no concerns with regards to that. And similarly, in the population of healthy adults that say, well, it's over, and why do I need to get a vaccine now? The same thing is going to apply as we go back into the fall and into the winter months, when we know that all of our viral illnesses start kicking up anyway. When we come back inside, we expect that there will be rises in COVID. Now, whether it has died off at that point in time and is less virulent, we don't really know. But it's important to realize that all of those same things are likely to come back to us, which is our quarantine guidelines, what that's going to mean as far as work is concerned, what that's going to mean as far as daycare is concerned, how that's going to affect people in terms of holiday gatherings and travel and so forth. And so we have a lot of people that are opening up now and doing a lot of travel, and they're asking questions with regards to that. And some places are using that as a vaccine gets you in or vaccine keeps you out.
Right. And without question, it's a heavily debated topic. And from state to state, you see different approaches. There are states that are putting in place mandates that vaccination status cannot be used as a entry into venues or not. And then there are states that are going the other direction and saying absolutely it can, and putting that into law. And then the federal government is saying we're not getting involved with those state decisions. And then you look at employer mandates for vaccines. Certainly healthcare facilities have started to go in that direction across the nation, that some large facilities have taken the approach of mandating the vaccine because it is safe, it is efficacious, and patients' safety and well-being is the top priority. But at the same time, we're still operating under emergency use authorization by the FDA. And from a Good Samaritan standpoint, we're watching all of this as it occurs, and certainly will follow CDC or guidelines from our Indiana Hospital Association. But at this time, we're watching that and would not make any further decisions on mandating anything until there's an FDA approval. But it is occurring. It is something that we continue to watch and look at. And I think it's a really good point to look at by age. It's very different in why get vaccinated or not. When the vaccine came out, late last fall, it was really touted, all boiled down to there were two main focuses of the vaccine. It was preservation of life. So when you look at the older population that really struggled with COVID, a lot of deaths, unfortunately, due to the virus, the vaccine was preservation of life. And then as you get into the younger population, it was more preservation of society and getting back to work. And as you mentioned, for even, take it down a step even further to school age, it's being able to not be quarantined, return to in-person learning or sports activities, everything that's moving in that direction. And, we're fortunate we're sitting here today in a situation to say that the vaccines as they came out accomplished those things. They certainly preserve life, and they certainly have sped up our ability to return to some normalcy.
Yeah, and it's certainly important to also realize that required vaccinations for activities, employment, and school is not a new concept. Both you and I had to be vaccinated for hepatitis B before we came to be employed here or where we were previously. Both you and I had to be tuberculosis tested before we came to work here. Children have to be adequately vaccinated before they move to the next level of school, be that into middle school, into high school, into college. Going into the military, there are certain vaccines that are required required for those experiences. There are certain vaccines right now that if you decided right now to travel to South America, that you would be required to get vaccinated with yellow fever, typhoid, tetanus, et cetera, before you travel. Meningitis vaccine before going off to college. So none of these things are controversial topics. All of those things are kind of understood that is simply a requirement to participate in an activity, to go to school, to be employed in certain instances. So although COVID conjures up all kinds of controversies that we can discuss, the concept of receiving a vaccine to participate in something, employment, school, or sports is not an unusual topic at all. So we certainly encourage people that are still out there that are considering the vaccine. We've been vaccinated. Our families have been vaccinated. We would encourage you to go out and get vaccinated. And thankfully, the availability of that now is great. And just think to the future. Think what school starting is going to be like and what the fall is going to be like and going into the winter months during our normal 6 seasons and use that to kind of guide you as to what that's going to look like.
The ourshot.in.gov has been since inception and still the site that you can go to find vaccine location. As mentioned, Knox County Health Department here locally, but there are other sites as well, retail pharmacies and in other counties if you work in another county or those types of things. I think Indiana, certainly a kudos to the state of Indiana. There is vaccine availability in all 92 counties to get vaccinated, and I know some of our neighboring states that hasn't been the same availability for many different various reasons. But in state of Indiana, really, it's not a long travel to be able to get vaccinated, so it's convenient. It's still covered through the federal program, so it is free. So those barriers are removed.
Yeah. And when we talk about all other things COVID, as we did basically weekly for an entire year, the availability of everything else is really good. Vaccine availability is tremendous. Testing availability is easy to access and quick. Treatment with monoclonal antibody combination therapy is easy to access and quick and available. So where we have come over the course of just the past few months or so as far as product availability and administration is tremendous. So don't stay at home. If you think you are sick, please get in and be tested, be treated if appropriate, and recover. Thankfully, it's been a long year, but a lot of things have been accomplished in a relatively short period of time.
And for any non-COVID related medical care that was put off due to concern, we have all services open as we have for many months now, mm-hmm. but certainly it is the time to get back in, whether it's, kind of back to that men's health plug, whether it's preventative care or if there was a known medical need, surgical, medical that was put off due to concern of COVID or any other reason. Now is the time to get back into that, connect with your provider. If you don't have one, find a provider. We have online and phone line resources to get you established. But having that partner in your healthcare, such as Good Samaritan, is really important.
Yeah, and one of the other really compelling reasons to discuss and encourage people to do wellness at this time of year is this is a healthy time of year. This is a very safe time of year to go to the doctor, to go to the hospital, to have elective things done. And so what we try to do in primary care practice with pediatric and with adolescent and with adult and geriatric wellness is to try to push a lot of that stuff into the summer months. Doctors' offices are not generally quite as busy with all of the acute illnesses and things that we generally have to deal with in the winter months. So we really push people, hey, this is the time to get in and get your school physicals. This is the time to get your sports physicals before they're due. Also get in to get your adult wellness done as well. Schedule screening tests. Get your laboratory tests done. All of those things, this is an ideal time of year to be dealing with that. Because there's not a lot of illness out there, we try to steer people away from coming in for their wellness visit in January or in November or in April because there's still a lot of illness that's going on around those times. So this is really a great time to be dealing with that. Again, as we talk about kids moving into school, everybody who needs a school sports physical or just a physical to participate in school, this is a great time to be getting in on that as well. So we would encourage everybody, if you don't have an established primary care physician, we have physicians that have appointments available and happy to take you on. We have a find a provider line through our hospital website to also establish with a primary care provider. So we would encourage everybody to go out and get established. Tiffany, did you have phone calls, messages, anything exciting from the phones for us today?
No questions.
Nothing today. Adam, anything else?
We were that thorough.
Well, that's fantastic. We thank you all for joining us, and we'll be back with you again, Tiffany.
2 weeks.
2 weeks, 26th, something, 28th, 30th. Okay. We'll have it on our website. Thank you all for joining us, and we'll catch you next time.